Okay, let us start the second session of our discussion. We will now proceed on the discussion of the data information and knowledge. But first, let's have the our activity. Okay. I just want to ask question of why knowledge is important in the nursing profession. So again, visit the slido.com and with the code 2618955. Your responses are very important simply because we will connect your responses to the topic that we have on data, information, and knowledge. So we'll wait for your responses. And later on, we have a follow-up question in relation to why information and why knowledge is very significant in our topic on the data, information, and knowledge. So again, join the slido.com with the code 2618955. So we have discussed all about what data, information, and knowledge is. It will make us more capable in providing care. I agree with your response because uh, we will gain confidence as well because we always take into consideration the safe and quality care management for our patients, wherein we have considered our patients as the core beneficiary of care. So that's why as nurses, as professional nurses, providing care as our core responsibility. And I think this will help us particularly on engaging the ourselves towards the appropriate care that we consider for our patients. The cognitive skills in order to provide the correct intervention. Correct. That's why whenever you do nursing care plan, whenever you do the performance of procedure to our patients, it always take into consideration rationalization. And the rationalization will consider validation. And the validation itself is evidently based from the knowledge. Okay. In particularly, the knowledge that we have considered, the knowledge that we have considered as a power is a way that we as professional nurses can influence the behavior of our patients. And influencing our patients matters because we are already providing high independence for our patients to decide by themselves, even in the absence of a nurse practitioner. Can give us greater power. So ayun, dun talaga, it emphasizes talaga that knowledge is really powerful. Now, this will also give us the point that it allows us adequate and holistic nursing intervention, correct? Because every time that every time that we discharge a performance of responsibilities for our nurses, it can give us the point that we'll consider the one that will entail us on the perspective that our holistic nursing intervention is very important to manage the patients, not just only the chief complaint but also on how a nurse will prevent the the complications. It will prevent seriousness and complexity of her health situation. And indeed, the point that the knowledge itself use particular use as a reference for standards of care, then the safety of the patient is our high priority. And expand information in order to have in-depth learning. Correct. Because once we translate the information to an in-depth learning, it becomes knowledge. Okay? And once this knowledge will be used in our future endeavors in the practice, this will become wisdom. So later on, we will expound more of what the DIKW pyramid means. Yan, I think I found a term that you have responded here that will give emphasis on knowledge. Foundation. Good. That's why a foundation concepts have been introduced to you during your first year in your health assessment, in your fundamentals of nursing, because these foundation concepts have prepared you in your second year level whenever you will encounter actual patients already. So I think those confidence that you have gained in the lecture, in your skills laboratory, will have an impact on how you will perform this even outside classroom, even outside school, even in your own families, even with your relatives, even with your peers. You're already sharing what you have learned, and that makes it more powerful. So as a foundation, this will consider yourselves already as in existence as future professionals. So continue this foundation as a power. So it contributed knowledge to establishing relationship. Correct. Kasi the exchange of information as part of the communication process establish the trusting and rapport to our patient. And thus, the exchange of information will be open because the patients will need to be truthful and will have the veracity, must have rather the veracity of telling those information for the nurse to attend. And sometimes there are situations that patients are very hesitant to divulge this information because somehow it may have an impact on the finances, it may have an impact on their work, socioeconomic status. So but with the trusting relationship and the knowledge that you have considered to share with to share rather with our patients, will still connect you, will still connect the patient to you and to him or her on the perspective that it can benefit himself and it can benefit the families and communities. So there are many health issues that we encounter. However, the role of nurses will take into consideration knowledge as a power and as a foundation. Okay, so we have highlighted terms in our activity here that knowledge and care are the most terms that have been used. Knowledge, that is very important for caring. And if you will connect in our first activity, you have answered that what are those terms or words that can be associated in the nursing profession. Still, we value caring in everything we do, and knowledge is the power that will manifest caring as our value. Thank you so much. So we will proceed to the next interactive activity. The next interactive activity is why information is necessary in nursing process. I know these four choices again are correct. Okay? These four choices are correct. All you have to do is to choose the best for you. Why information is necessary in nursing process. We are aware nursing process as a systematized way on how we will engage in clinical decision making, in assessment, diagnosis, planning, intervention, and evaluation. The ADPI are very important when it comes to nursing process because it provides appropriateness. It consider application of the learned knowledge, skills, and values. It will uh, it will consider also as the reference on how you will contribute to your units and communities. So I think these four choices are the following of why information is necessary in nursing process: safety of patients, protection of nurses, basis of legal functions, performance of standards. So again, all of these are correct, but all you have to do is to choose the best. So even in the nurse licensure examination, all the choices are correct, but you can choose the best answer. So almost 100% are responding to safety of patients. Others can continue to put all your responses. Continue to put all your responses there. So protection of nurses, probably just to give you an overview, is when you perform tasks, you consider the information of protecting also yourselves. Just like for example, if you have the information of the patient, if they have communicable diseases, then you will take also precautionary measures to protect yourselves. The concept of isolation and reverse isolation is applicable on this. Basis of legal functions. Probably the laws, the existing laws, institutional protocols that we know may consider that our action, this information could be powerful on how you take part on the legal imperatives of your actions. Performance of standards. What you have learned will be reinforced of what you will do. So in the performance of standards, you have learned the standards on how to basically consider to basically perform vital signs. And I think the knowledge for you to consider if they're already in deviation of the normal range, then that will be a way on how you will translate this knowledge into a more useful and meaningful performance of task for the patient's sake. Okay, so will there be other responses on the floor? So it's in safety of patients. Okay. In the safety of patients, it's really our core responsibility as nurses. And in nursing process, we always consider diagnosis as for the nurse to support and prevent its complication, right? Another is uh, to promote basically the patient's health condition towards recovery. That is usual. That is the usual direction of why we consider this information in the nursing process. Even in the safety, even in the subjective and the objective data, we translated this into information so that it will be the basis. It provides connection. Uh, with the data, subjective data, and the objective data, these serve as our information to formulate the appropriate diagnosis and set the planning for objectives for SMART of specific, measurable, attainable, realistic, and time bound. And when it comes to the interventions, the appropriateness itself provides safety so that to basically, again, as what we have mentioned, promotive and preventive aspect, even curative for purposes of pharmacological management, and collaborative as well. And the evaluation itself will still consider if we have not met the objectives, then we will redirect again our care towards achieving the goal of care. So with the 100% of the responses, I truly believe as future professionals, you're considering this that the information that you may gain in this class will be the reference, your reference of determination to always put in your hands, in your mind, and in your heart that in this profession, these are the four reasons why we consider nursing process and information as very relevant. And thus, with your response of safety of patient, I truly believe that you will be an advocate of patient safety. Thank you so much for your responses. To continue, as we continue with this discussion of data, information, and knowledge, the data refers to observation. That's why when we initially discuss terms, numbers, you have many responses because it's very broad. It did not give specific meaning. It's meaningless. Meaningless meaning because probably there are no basis at all for you to be directed to the right answer, right? So another information is in relation if it has already specific meaning and it answers the 5 W's of who, what, where, when, and why. When 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 a data or an information is presented to you and you have less questions and clarifications, it means it's clear already and that may consider information. But if it still consider lots of questions and it did not answer the 5 W's, that is data. Okay, so the knowledge itself is it will validate now this data and information into meaningful use. So that's why if you use this as a basis for decision, because it's a normal temperature, it's a normal weight, it's the normal heart sound, it's the normal heart rate, blood pressure. So because you have learned it, you have learned it from your experiences, from various legitimate references, web sources. So that is what we call knowledge. Okay, so that's why you have considered it as power. So I will be showing to you now a video presentation that will give us a more view or clear view of what data, information, knowledge, and wisdom pyramid means. Let us watch for a while.
The DIKW pyramid is an example of a simple model used to help us understand a more complex topic. It is also very relevant for data analysts to know and understand. The DIKW pyramid is used to help explain understanding as we go through the evolution of working with data to transform it into information, knowledge, and eventually wisdom. In this manner, we develop a better understanding of the structural and functional relationships between data and wisdom. At the base of the pyramid, we have data. Data is very abundant, but it is also relatively meaningless. Data consists simply of raw values or measurements. Information is the next step up in the pyramid. Information consists of data with the addition of context. Context is supplemental data that provides meaning to the original dataset. This can be information such as who, what, when, and where. Notice that data and information are often objective in nature. The third step in the pyramid belongs to knowledge. Knowledge is information with the addition of experience. Experience can be gathered secondhand through studying books, such as in college. Experience is also accumulated firsthand from life and work experiences. With knowledge, we are now incorporating subjective expertise as different people will have different experiences to shape their understanding of information. At the narrow top of the pyramid, we have wisdom. Wisdom is knowledge plus the addition of action. Wisdom determines what we do, or do not do for that matter. Wisdom is also subjective, as it depends on our interpretation of prior knowledge. When we step back and reevaluate the entire pyramid, we notice another trend that separates the tiers. Data, information, and knowledge are all established in the past, whereas wisdom is used to establish forward action. Wisdom is future-looking, while the others are backwards-looking into the past. As you move up the pyramid, you'll also notice each tier has more value than the tier before it. The inverse of that is as you move down the pyramid, the tier below has decreasing meaning. As an example, information is more valuable than data, as data has less meaning than information. Context distinguishes information from data. This concludes the DIKW pyramid model. Using this simple pyramid model, it should be easy to see how a lot of information can be conveyed using a simple graphic model.
So this video presentation have clearly explained of what the data, information, knowledge, and wisdom is. So if we consider data, these are raw values or measurements. So from the example that I gave to you, 37. So you have responded many meanings and interpretations. While the information on the context itself that I have identified or that I have considered identifiers, I have considered degrees Celsius. I have considered also, for example, 37 degrees Celsius. So the 37 degrees Celsius refers to a temperature, right? So if we have 37 kilograms, then this refers to a weight. So that's information. If we consider 37 degrees Fahrenheit, it is still a temperature. But again, it may have different interpretation because 37 degrees Celsius and then 37 degrees Fahrenheit is different from each other. Next, 37 uh, pediatric clients are seemingly an information that identifies a number of patients in the admission of wards, in admission in the pediatric ward. So many of these numbers that when we associate an identifier becomes in the context information. Now, when we've considered this information and 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 basically maximizes opportunities for us to learn, it's by experience, it is by sources, it is by self-paced learning, then this becomes knowledge. Okay, the knowledge that we are considering is, for example, the information We have 37 degrees Celsius. The knowledge itself will become for a nurse to consider that 37 degrees Celsius is a normal body temperature. Thus, this will translate now into an action that will serve as your future reference, and this becomes a wisdom. The wisdom itself, once you carry this, for example, you have learned this normal vital signs during your fundamentals of nursing. But as you reach the higher level, second year, third year, and fourth year level, and you still apply those principles that you have learned as your knowledge, it becomes a wisdom. Okay, always bear that in mind. That when you apply, for example, and take the vital signs of the patient, and you say 37 degrees Celsius, normal po ang temperature. Your body temperature po is normal. However, you need to consider po monitoring, still for monitoring of your temperature because you have an existing infection. So you can relate what you have learned from the normal body temperature to the case of the patient, and that is already wisdom because you are expounding more explanation in relation to what you have learned in the various concepts of nursing. Okay, so now in particular, we have just set just a review of what data means. So examples nito ay 98.6, 89 female. I know most of you will respond many interpretations on this. When we translate this into information, 98.6 degrees Celsius or degrees Fahrenheit, this refers to temperature, but only the 37 degrees Celsius and 98.6 is of the same equivalency when converted into degrees Fahrenheit. So, but if we have a wrong identifier, 98.6 degrees Celsius and 98.6 degrees Fahrenheit, it matters on that interpretation, and it's wrong. So you need to place a correct identifier so that you can consider a correct interpretation. So just like 98.6 degrees Fahrenheit is the same as 37 degrees Celsius. Just like for the 89, if we put years old, it pertains to age. 89 pounds or kilograms pertains to the weight. For female, it has considered as a gender, but it could be more considered as information as female nurse, female patient, female elder. So I think this will give more specificity on the data to information. Now, let us connect the concept of why we have theory and connection. And I will relate to you those examples later on. So we have clinician, it's generic. So this could be probably data. Why? Because there are many clinicians. It's not just only it is not just only nurses. We have doctors, we have other healthcare professions as clinicians. Even even on the perspective of other professions, if they use these clinicians, they may answer many responses. Healthcare interventions. This is data because the healthcare interventions uh, it's broad in scope. It may depend definitely on the patient's problem. So that's why the patient also is generic, and that's why it's a data because we have many patients and we need their profile to identify the specific factors that may affect her health situation. Problem, obviously, many of us have health problems, very broad, kaya data siya, di ba? Outcomes. Outcomes are also broad in scope because it is dependent on the health problem and interventions. Just similar when you are having a blank form, electronic or printed form on patient's profile, patient's history, a blank form. Those are data. But once you fill those forms, you are already translating data into information. Let us now connect an example on this. For example, a situation, a public health nurse visited a high-risk pregnant teen with substance use problems who needed healthcare. Question, data or information? So we need to analyze this into this perspective. A public health nurse. Ang public health nurse po ba ay data or information? Again, do a public health nurse is a data or information? You may respond your answers in the chat box. Again, do a public health nurse is a data or information? I will wait for your responses. Public health nurse, is it a data or information? I saw already an answer. Sige, continue. So, your responses are definitely divided. We have data, we have information. So, continue. So, is it a data or information? Public health nurse. Data, information. Okay. So, continue your responses. Okay. Okay. Information, data. Okay. Now, I will explain to you now. A while ago, we have discussed about clinician, di ba? Clinician, very generic. So, data siya. So, if we have responded nurse, nurse is already a clinician. It's already an information. But it specified more on the field of practice, public health nurse. So, it means that, okay, it's information. Bakit information siya? Kasi it already specified nurse as a clinician, public health nurse as more specific scope of her practice. So, information siya. Okay? Now, pag data siya, clinician, kunyari nakalagay doon ay attended by clinician. O, sinong clinician? Diba? So, hindi na-answer yung yung 5 W's. But it answered the 5 W's who attends the patient, the public health nurse. O, information na siya. But kung gusto mo pang malaman kung sino yung public health nurse, nagiging information din siya. Okay? But somehow, if we are considering the generic for clinician, it's public health nurse. Okay? So, the high-risk pregnant teen, if you can encounter po pag sa data sa patient's profile, di ba sa patient's profile, name, age, depende on the protocol, name, age, socioeconomic status, yan, yung mga usual demographic profile, gender, we're considering it. If we're considering it dito sa high-risk pregnant teen, pregnant, it identifies the condition, obviously, female, high risk, yung health condition niya, teen, yung age group. So, in this perspective, is this data information? We will answer that later. Substance use problem. This is a health problem. Did it specify already the health problem from this situation? And the last that has been highlighted is needed healthcare. In the needed healthcare, is this generic or broad? Let us respond and answer. Okay, let's proceed to the next slide. Okay, high-risk pregnant teen. The data that we're considering here is demographic data. Diba? Pag demographic data, did it identify the population group? Did I identify the type of patient? Yan, demographic data yan. Yung problem terms is it will identify the specific problem kasi data nga siya. Healthcare intervention, data siya. It's because it's generic, it's very broad, and also with outcomes measures. So let's go back to the highlighted terms in the situation. High-risk pregnant teen could be considered as information. Why? Because it specified the teen, although the teenagers, as based from literatures, are having the specific age. But it already identified teen eh. Pregnant, specific, high risk, specific. So this is information. Substance use problem. Substance use problem, it identified already the health problem in general. Di ba? Pag sinagot mo yung health problem, substance abuse. It's already information. But if you want to be more specific, kasi yun yung tayo eh. We are not satisfied only with substance abuse. But we already consider this as information. Magdidig pa tayo with another question. What substance abuse have you used? So pwede rin yon. Okay? Yung substance use problem is already an initial initial information, tapos magdidig ka na lang into more specific. what substance abuse, how many times have you taken it, amount of the substance that you have used. Okay, if you go back to the di ba? If you go back in our concepts of pharmacology, may mga doon, di ba? We have discussed about the substance abuse from the heroin, from the codeine, from the alcohol, tobacco. So yun. So pwede nating i-associate dito yon to be more specific. Pero dun kasi nagsisimula yung initial information, ang nurse pa wants to be more specific. Ayan. So pumapasok na ngayon yung ninyo, yung learning ninyo from the past, that when you took similar situations or encounter situations of patients like high risk pregnant teens, you always ask you always need this information for purposes of appropriate care. So dun sa needed healthcare, eto tanungin ko kayo, needed healthcare, data, information. Did it answer a specific did it answer specifically needed healthcare, data or information? Pag sinabi sa inyo needed healthcare, did it answer directly your concern? So, please type in the chat box, needed healthcare, is it data or information? Tingnan nga natin. Yan, sige, may response na ako nakikita. And correct. Okay, don't mislead pag may clarifications kayo. Pag needed healthcare, hindi pag needed healthcare tapos ititingnan niyo yung 'di ba pag data walang meaning. Para maghahang ka, what specific healthcare, 'di ba? Pagka information siya, it answers the 5 Ws already. Okay have those realization and basis Needed healthcare. Please type your responses in the chat box, please. Okay. Ayan. Some of your responses, ayan, I'll check other responses. Ayan, okay. Now, majority of you answered data. Bakit data siya? Kasi kung if you will be asked by the doctor, needed healthcare, hindi ka na ba ulit magtatanong ng further question? Doc, what do you mean by needed healthcare? There are many healthcare needs that will have interventions. O di ba mag-explore ka pa ng mga questions na to satisfy you with the 5 Ws. So the answer here is needed healthcare is data. Okay, sige. Next question tayo. Next situation. In the next situation, a critical care nurse attends to a pediatric client with congenital defects that may need immediate care. Again, critical care nurse obviously is an information because it identifies already the clinician, the specific clinician. Now, let us proceed with the highlighted terms. Pediatric client, congenital defects, need immediate care. Okay, now, let us proceed on our analysis of if it is data or information. Pediatric client, congenital defects, need immediate care. Let's start with pediatric client. In demographic data, di ba, aware tayo that the general classifications of client, pediatrics, elders, adults, does it give you initial what do you call this? Initial answer on the 5 Ws on the pediatric client? Was this a data or information? Kasi pagka you consider it as information, magdidig ka na lang into other questions to satisfy you specifically with responses, with those responses. Do pediatric client a data or information? Pediatric client. Okay. Okay. I think one answer I have received. So the answer is probably information. To what extent? Why information? Because it already answered one of the 5 W's. Pag client lang yan, it does not satisfy the 5 W's, but you consider pediatric client. So it answers the 5 W's. So specifically, in one of the 5 W's yung who, pediatric. Tapos magdidig na lang tayo kasi ang pediatric client, di ba, infant, toddler, preschool, school children. Doon na lang tayo magdidig para mas maging relevant information pa siya. But the pediatric client already give us a more focused response. Congenital defects. Congenital defects, health problems ito. Was this a data or information? At first, iisipin ninyo congenital. Okay, congenital specific na siya. Okay? It answers what? Health problem. Tapos, tsaka na lang tayo magdidig doon sa, is it heart disease, skeletal, pulmonary, kung anong congenital defects. Diba? So, it answers already the what. So, this is information. And need immediate care, eto, although it's an emergency intervention, the problem here is that of what immediate care do you mean? So that translates into a data. Okay? So hoping these exercises can already identify po yung inyong knowledge about data and information. And in this situation po, we are now on the last few slides. I know that when there are terms that you are not familiar, you always use tools to search its meaning. It's either Thesaurus, Dictionary, Google search, Yahoo, and other applicable platforms wherein you can gather information online or offline. So with these meaningful tools, the semantic tools itself helps this transform or convert data into useful information. In this way, the semantic tools are very important. Let us just take into consideration if it's a legitimate tool, because there are some instances that we are searching for the meaning to a wrong sources or web links. And that makes vulnerable for fake news, fake information. So I think we must be more vigilant. So anyway, there are offline and online semantic tools that you can use. When these tools provides the meaning and the language, these are semantics already. Kaya pag sinabi semantics, this is the meaning. Okay? And its relationship. Example, yung binanggit natin na 37 degrees Celsius, you entered it in the Google. The 37 degrees Celsius, it provides meaning as normal body temperature. Yung normal body temperature is already the meaning. That is semantic. Kung saan nanggaling yung source of normal body temperature, ay nanggaling siya from semantic tools. Kasi yun yung na-maximize mo as resources to consider and to gather the needed information. Okay? So the meaning itself gives you a higher level or value. Sabi nga, di ba, dun sa video presentation, information is valuable than data because it gives meaning. The meaning that is being provided is semantic, and the semantic tools are from the sources of information. I could be a semantic tool because I could be the facilitator who provided you the information. However, I need to still have the citation where I got this information for validation. Is it from book? Is it from researches? Is it from the legitimate sources? Yun. I still consider yung semantic tools na yan. Okay, now, there are vocabularies that we encounter. Pag sinabi natin controlled vocabularies, there are some situations that you encounter codes, symbols, but it already sets meaning when you see it. Yung example RX, RX always gives you meaning on prescription, right? Another, alam niyo po ba that there is coding for diseases? Meron tayong tinatawag na ICD, International Code of Diseases. So, a typical example on this is yung tuberculosis example ha. Ang tuberculosis is ang International Code of Disease niyan 7Z.11. So pag nakita mo yan sa nakita mo yan into a document, ICD code Z.11. For a nurse who is aware of the International Code of Diseases, ang diagnosis niya ay tuberculosis. Okay? So magkakaiba pa yan, pulmonary tuberculosis, TB of the spine, TB of the bone. So, particularly may mga International Code of Disease. Kaya lahat po ng diseases po, actually the most updated is the ICD-10. If you will search the ICD-10, ito po yung trabaho ng mga medical transcriptionists when the information is being sent by the US counterparts to the Philippines. Nandito naka-base yung ating medical transcriptionists who are also nurses. When they receive ICD code 7Z.11, ibig sabihin, she will focus on the review of the records of the patient on tuberculosis. If it is aligned with the medication, if it is aligned with the diagnostic examination, para ma-cover siya ng insurance. So that's the point why we really need to know the ICD. Kasi alam niyo po, class, this will help po. Ako, I would advise you to search on this kasi para for sure this will protect our individual patients. Kasi hindi mag-a-appear yung mismong diagnosis sa record niya na tuberculosis. Kasi if any layman will see the diagnosis, syempre ano din naman confidentiality, but for only those who are trained rather, who are aware of what ICD codes is, ang tawag diyan controlled vocabularies. Okay, next. Pag sinabi naman nating taxonomies, ang taxonomies naman ay yung defined terms and interrelationship. So it shows relationship. Yung pathophysiology, if you are aware of the case study, these are taxonomies or ontologies that you will start with the causes, the factors, tapos what will be the effect to the anatomy and physiology. What are the deviations that happen and develop particularly the diagnosis. So why the patient leads to death? Because the patient did not attend to pharmacological management. Ang tawag dyan, taxonomies or ontologies. It shows the relationship. Another, for example, sa atin pa lang, sa science pa lang, biology. O sa biology, maraming mga branch of sciences diyan, di ba? So, and indeed, it shows that we have the study of plants, the study of specific plants. So this will facilitate on how it will branch to the concepts to a broader scope and specificity. Yun yung tinatawag nating taxonomies. So another is another example of taxonomy, organizational structure. Diba in a school, or even hospital, it starts with the administrator going down to the front line who are staff nurses. It shows relationship. Okay, so representation. Okay, so that is what we call taxonomies. Next is we have interface terminologies. So interface terminologies naman po, when you enter any information that is needed from the data, yun yung tinatawag nating interface terminologies. For example, you are given the blank form. You are given the blank the access for a blank survey. Data pa lang yon ang nandoon. But when you enter the information, when you enter the specific response rather, that translates now into information. Just like for example, if you're assigned in the hospital and you attended the patient in the emergency room and you tick already the alarming signs that the patient have, the previous drugs that the patient have taken, and once you filled it up, it's already interface terminologies because you supplemented all this information already to be useful, right? Next po, Yung reference terminologies naman is if the information had translated a higher level of analysis. Yung kaya tayo minsan if when I define, for example, a set of concepts and relationships that provide common reference as based from the health informatics book by this and author. So it means that those terminologies that I am mentioning here in our discussion particularly has a source. And indeed, yung sinabi natin kanina, 'di ba, semantics and semantic tools, eto mas broader pa yung explanation kasi it gives you analysis. A typical example, pag if you are seeing into the statistics yung graph, kunyari 37 degrees Celsius, 37.8 degrees Celsius, 39 degrees Celsius. Nakikita niyo yung yung graph niya is going upward, tapos red, and the red itself considered as deviation from the normal temperature. At nakikita niyo that it's increasing over time. So yun pa lang, tapos may interpretation na siya, you're starting to do interpretation or may nakuha ka pang literature that explains the continuous increase of temperature in the specific diagnosis, ang tawag doon reference terminologies. Okay? So next po, pag interoperability standards, these are the wherein when you share already those information. For example, shinare ko sa yung information kanina, yung kanina minention natin yung I'm sorry. Minention natin yung interface terminology. We enter the information. Pag ang interface terminologies natin ay shinare na to doctors, to nutritionists, to pharmacists, technically, it's interoperability standards na. When it is already shared. Just like, for example, when in the Neo LMS, when I share the results of your self-assessment exercise and you viewed it, ang tawag doon interoperability standards na. When I shared with you the uploaded, kasi merong ano yan merong operations siya na hide. Pero if I already shared it with you, yung mga learning resource materials, ang tawag dyan, interoperability standards already. Ha? So, I think in those perspective, we have the so-called informaticist. Okay, ang informaticist naman, we have mentioned that if you become an informaticist and even though you're a nurse, you're already considering po your role that you are translating data, information to knowledge. And the point that we have considered that the knowledge is being used and translated it into the use of the technology, ayan, nagiging ano ka na, informaticists. So these are the individuals who are having the expertise in processing information and using technology as well. Ngayon, we are now on the last two slides. Ito naman po, may mga situations na nagkakaroon tayo. There's no perfect information technology. Etong semantic equivalence, pag sinabi natin kasi di bang semantic, meaning na siya. Pero pagka if you will encounter the phrase itself, it may have the same meaning. Pero in medical terms, it must be recorded na aligned with our perspective sa medical. Example, there are concepts na complex na sometimes layman hindi siya masyadong specific. Kaya that's why we use the terms in the medical field. At para po tayo as professionals can already dig po into other questions para mas makuha pa natin yung accurate information. So, for example, elevated blood glucose. Elevated, increased blood, obviously the blood, and glucose, we are referring to sugar. But if you will just refer it to, the patient has high sugar. High sugar of what? High sugar? High sugar for what? For the ano ba yan? Is it food content? High sugar in what sense? So pag elevated blood glucose, mas particularly gives us more a more clear meaning, a more clear perspective when this will be mentioned. O sabihin ng doctor, oh, your patient has high sugar. Okay sir, the patient has ano po, hyperglycemia. But if the doctor will say, oh, your patient has elevated blood glucose, okay, you are confident, you are more confident to say that the patient has hyperglycemia, di ba? There are some situations also when you encounter someone who's taking blood pressure. Sasabihin, 120/80. Okay, 120/80. For us nurses, it's a normal body, it's a normal blood pressure. But for some, if you will listen to some who are not trained, for example, the patient had 140/90. Mataas yung sa puso mo. Kasi yun yung 140, yung 90 mo sa dugo okay naman. Remember ha, those individuals may really need more education, or more what you call this, um more information, that the blood pressure is a combination of the function of the heart, the blood vessels, and the circulatory system. So I think yun ay isang ano lang yon, isang ano lang yun. Although in the one, it identifies separately yung systolic and diastolic, pero as a whole, it's a blood pressure that composed of the pressure created within the heart's blood vessel. So yun lang yon. So pagdating dito naman sa semantic gaps, para to bridge yung semantic gaps, kasi yung data may not fully represent the meaning. Pag sinabing high sugar, ano po, okay, elevated blood glucose. Okay, aware tayo, elevated blood glucose, sinabi ng doctor. Pero ano yung mga evidences mo as nurse para ma-identify kung what is the cause of the elevated blood glucose? Kaya that's why we dig more on questions pa. What is the patient's typical blood glucose? What did the patient eat that contributes to the high blood sugar level? And what medication is the patient taking so that to control the blood sugar level if the patient is diabetic? So these are the things that we need to consider yung questions so that to validate yung tinatawag nating semantic gaps. Okay, so I think that ended my the second part